Kids, teenagers and youthful grown-ups are at more serious hazard for extreme entanglements from COVID-19 than recently suspected, and those with fundamental well-being conditions are at considerably more serious hazard, as indicated by an investigation co-authored by Rutgers specialist. The examination, distributed in JAMA Pediatrics, is the first to portray the attributes of truly sick pediatric COVID-19 patients in North America. The possibility that COVID-19 is saving of youngsters is simply bogus, said study co-author Lawrence C. Kleinman, educator and Bad Habit Seat for Scholastic Turn of Events and head of the Department of Pediatrics Division of Population Health, Quality and Implementation Science at Rutgers Robert Wood Johnson Medical School. While kids are bound to become ill in the event that they have other interminable conditions, including heftiness, note that kids without ceaseless ailment are additionally in danger. Guardians need to keep on paying attention to the infection. The investigation followed 48 youngsters and youthful grown-ups from babies to 21 years of age who were admitted to pediatric serious consideration units in the United States and Canada for COVID-19 in March and April. In excess of 80% had constant basic conditions, for example, resistant concealment, stoutness, diabetes, seizures or ceaseless lung illness. Of those, 40% relied upon innovative help because of formative postponements or hereditary irregularities. In excess of 20% experienced disappointment of at least 2 organ frameworks due to COVID-19, and about 40% required a breathing cylinder and ventilator. Toward the finish of the subsequent period, almost 33% of the kids were as yet hospitalized due to COVID-19, with 3 despite everything requiring ventilator backing and 1 in a coma. 2 of the kids conceded during the 3-week study period kicked the bucket. This examination gives a gauge comprehension of the early illness weight of COVID-19 in pediatric patients, said Haripren Rajasekhar, a pediatric intensivist engaged with leading the investigation at Robert Wood Johnson Medical School's Department of Pediatrics. The discoveries affirm this rising infection was at that point across the board in March and that it isn't all around benevolent among youngsters. The specialists said they were circumspectly energized by emergency clinic results for the youngsters examined, referring to the 4.2% death rate for pickup patients contrasted and distributed death paces of up to 62% among grown-ups admitted to ICUS, just as lower occurrences of respiratory disappointment. Kleinman noticed that specialists in the New York metropolitan region are seeing what gives off an impression of being another COVID-related condition in kids. In spite of the fact that our information assortment for this investigation has finished, we keep on creating coordinated efforts with associates in our district and the nation over to attempt to comprehend these progressively serious inconveniences, he stated, referring to concerns, for example, cardiovascular breakdown and the Kawasaki illness-like condition named Pediatric Multi-Framework Incendiary Disorders Models.